a brand new hospital wing equipped to treat COVID-19 patients. It was set up 10 years ago to handle emergency overflow during the Soccer World Cup. It was fast becoming a white elephant, but now has a new lease on life. New coronavirus infections in Nelson Mandela Bay surged past the 7,000 mark.
Now it has come in very handy now when we wanted more beds as part of our response to COVID-19 pandemic. We found a structure which was half prepared to be converted to a ward. So with the assistance of the Department of Public Works, we managed to convert this to a habitable ward as it is now.
73 beds stand ready with oxygen supply and ventilators.
But this one is a backup, and it assists that the lung doesn't collapse, so that when the patient starts the next breath, then it doesn't start from north. It starts somewhere, and then the work of breathing is not as heavy.
This ward will treat COVID-19 patients with comorbidities.
All the beds here have access to oxygen. We obviously, because these are additional beds to the complement that we already have of beds for COVID-19. So we had to add more nurses, and we were supported by our principals in the Department of Health in Bisho and government, provincial government in general. So we have hired 22 more professional nurses, 8 more staff nurses, and 16 more nursing assistants.
The ward is fully operational, ready to treat the first patients. Kim Daniels, SABC News, Port Elizabeth.
Thank you there, Kim. Now, to discuss this further, we're joined by South African Medical Association chairperson, Dr. Angelique Cozier. Doc, what does one say? 2,000 average 2,000 infections over the past couple of days or week. Last night we breached the 3,000 mark. It does not look good for South Africa, as we've been saying. Stave off that second wave, but it looks like it is surely creeping up upon us.
Yes, good afternoon, Tabiso, and a good afternoon to all the viewers out there. Yes, you're right. This is worrisome. I remember we, from summer side, predicted that we will get a second wave going forward. Although this in Port Elizabeth and the surrounding areas are mostly only confirmed in those areas, we also know that going down to the Western Cape, in the George area and George surroundings, we also have a problem. And it is extremely difficult to control the infection rate currently. And one of the reasons why it's so difficult to control it is because, and I'm going to use a language that maybe some people will be offended with, but it actually expresses people are hurtful. They don't want to wear masks anymore. They don't want to do social distancing. They don't want to listen. And besides it, they can't see the virus around them. So this is one of the most significant factors why we keep on seeing a surge in these areas. And the National Department of Health will have or give a close look into those areas and need to contain the spread of the virus, especially in those areas. So if this gets higher and higher in those areas, it would be prudent to start with stricter restrictions and the enforcement of those restrictions in especially the Nelson Mandela Bay municipality. And as I have said, please do not forget the George area. Yeah. In the Western Cape, that's also having trouble and difficulties at this stage.
Yeah. And I remember, Doc, when, in the midst of the pandemic here in South Africa, there was a huge outcry, in particular, that particular region where people from the Eastern Cape and the Western Cape, through that passage, through George, where people traveled because by virtue of economics, people would leave the Eastern Cape and go work in Cape Town or the Western Cape, then come back home. So there has always been a worrisome one, and that put a lot of strain, in particular, to the Eastern Cape, which is possibly one of the not so better off provinces in the country.
Yes, you're right. So what is more concerning is we all know that the festive season is going to start. It's 4 weeks away from now, and the Nelson Mandela Metropolitan is also quite a famous place for holidaymakers to go to, as well as the Western Cape. So if we cannot get these areas contained, it might spread further, and from there it can go easily to KwaZulu-Natal. It is really, really a concern. Mm-hmm. And seeing it was this week was antimicrobial week as well. Again, we need to alert the viewers out there. There is no antibiotics that you can take when you've got COVID. We do prescribe Zithromax, erythromycin at this stage, but that is not to contain the virus. It's only to help if there's any secondary infection. So it is really the only way that we have in trying to curb this virus is the masks, the social distancing. I think if I wake you in the middle of the night and I say, what is the mantra? You need to say the mantra is mask, social distancing, hand wash, air conditioner, not on open windows and doors as much as possible. Yeah. And that is what we have. And then you have seen in the picture that they focused on the oxygen and the ventilators. That is not so much the ventilators, but the high flow nasal oxygen is extremely important, and that might save the lives. But again, to open up 73 beds, it's not a lot of beds if you look in terms of the amount of patients. But if you look in terms of the healthcare, your doctors, your trained physicians, your emergency care, your trained nursing staff, then it becomes difficult because we don't always have that resources. And I can tell you that the average doctor working in or specialist working in these COVID units or in ICU units, they are burned out. We have seen it, and it becomes the longer this carries on, the more exhausted you are getting, or you are going to see your doctors become, and nursing staff. So it is really a problem, and we have to listen. Again, please, if I can ask from SAMA's side, please don't go and have these big Christmas parties. Yeah. Please don't go and have, if it's not a Christmas party, have these braais or get together at night, especially in close environments. If you can have it in out in the open, that would be less troublesome, and your chances to get the virus or spreading with the virus in an open environment will be less. Yeah. But it's very worrisome, and it's very worrisome for SAMA. If you look at all these, the current strikes that you see, and looking at the masses, and more than half of them don't wear masks. They stand next to each other. There's no social distancing. The only plus factor is that it's out in the open, but it's dangerous. It's so dangerous. People doesn't listen what we are saying. Yes. They have to start listening.
Yeah, Doc, I mean, you mentioned pandemic fatigue, as it were. You used your nice word. The question, though, and I guess it comes back to the basics. I mean, South Africa, we talked about how well we did on the first wave hit us, because I think everybody joined in on the narrative: wear your mask, wash your hands, social distance. That fatigue has obviously seems to have set in. One would think we would have learned our lesson if you look at countries like the United Kingdom, Spain, Italy, the United States of America. One would say the most civilized, with inverted commas, of democracy. They're saying, look, it's my democratic right to have my own choice. One would say maybe sometimes democracy is not good for you, in particular when people like that could say, I do not want to wear a mask. But it's imperative, because at the end of the day, it's not about you, it's about the other person that you could infect.
You're so right, Toby. So I always say that the fact that I wear my mask out in the public is because I care about you. And if we don't care about each other anymore because it's my right to do what I want to do, that is extremely selfish. And it's wrong. It's so wrong. It means there's something wrong with the way that you are thinking. Because if you are the most important person in your life in times of a pandemic, then it's a sad day. Because you have to listen and you have to care about people around you. We as people, what are we if we don't care anymore? Did we lose our compassion for other people? Did we lose our self-respect for ourselves to say, I don't want to wear this, I'm hurtful, I'm not going to wear this anymore. Besides, I can't see the virus, while we're all telling you what to do. You will notice that Sweden in the beginning was also very open and they didn't bring in strict restrictions. And in the beginning, it seems as if their strategy was working. But even they now, at this stage, is bringing in strict restrictions. And one of them is, again, wearing the masks. It is so important. I know it's only like a piece of paper or something, or a piece of material, and one cannot think, how can this work? But it's working.
Yeah.
And so must plead to everyone out there, please wear your masks. If you don't care for yourself, please just show that you care for me. You never know that the person next to you might be having severe uncontrolled diabetes, and you are a carrier of this virus without you being sick. And you are actually indirectly responsible for the death of that patient.
Yeah.
Standing next to you because you didn't want to wear your mask.
Yeah.
Please wear your masks.
Doc, we're running out of time, but just maybe 2 quick pointers here. The one thing, again, on the plea on the back of that, we always speak about the numbers and statistics. We speak about South Africa's 92.7% recovery rate. Maybe one could say people are looking at that and saying, the likelihood is that I'll recover. On the flip side, you do not want to be on the other side of that 92%, be that 7.3% that actually die from it. And secondly, and as far as what we're looking at now in South Africa, are we at that second wave, or for now it's just a cluster?
For now, it's just cluster outbreaks that we are seeing. But this cluster outbreak, it's like a little fire. If we do not extinguish this fire very quickly, this fire can become a real big problem, and it can spread. You know how easily and how fast a fire can spread. We should not feed this fire. And again, we have said right from the beginning that more than half of the patients would not even know that they are positive, that they have the virus underlying. And we also said that about 10% will be admitted. And of that 10%, 5% will end up in ICU and half of them will die. The problem is, once if you have seen how bad that patient are, you will have for the rest of your life, that image will stay with you. But because the average person cannot see it, because the average person, they are not allowed to visit their mother or father in the ICU, they've got no clue how bad it actually is. But I would also warn you, do not want or do not become part of that stats, because it's really it is mind-boggling to see what is happening in an ICU with your loved ones that you cannot see, you cannot visit. And that is one of the problems. It's too far and removed from the average person out there. As doctors and nursing staff, we know what is happening. And that's why, even if it's 8% ending up in hospital, that's why we are so out here and trying to motivate people. Please, you don't want to become part of that stats. Please.
Dr. Angelique Coetzee, South African Medical Association chairperson, thank you indeed for joining us. Run out of time, and with those words, hopefully South Africa is watching and taking it in. You do not want to be part of those stats indeed. And maybe, Dr. Coetzee, we should have some sort of advertising and showing glimpses of what people go through, because sometimes South Africans would want that shock factor to actually realize what the frontline staffers like yourselves go through with regards to helping us at home who would be careless enough not to take care of ourselves. Dr. Angelique Cozier, thank you very much, ma'am.